Now to an emerging problem with deadly consequences in East Texas. According to a new study by UT Tyler, children in our area are nearly 2.5 times more likely to die during childhood than the national average.
It boils down to lack of access to health care and resources. Our Ashley French gives us a closer look.
Almost half of the counties in our Northeast Texas region don't have a pediatrician.
No nearby pediatricians means some families in East Texas are lacking in health care for their children. A new study from UT Tyler says almost 60% of kids in our area have to travel more than 80 miles for specialty pediatric care.
There are 105,000 children who live in Northeast Texas who do not have a pediatrician in their county.
Valerie Smith is the author of this study and an assistant professor of pediatrics.
So one of the goals here at the School of Medicine is really to help identify why is that happening.
She says the lack of healthcare access for children is a critical issue, and it's worse in East Texas than any other parts of the state and the country.
I intuitively knew from my experience that we dealt with more problems or bigger challenges than many of my colleagues who are in other places in the country.
The state of Texas has one of the highest uninsured populations in the nation. Children in Northeast Texas are more than twice as likely to be uninsured than the national average.
And so we know that we have children who are facing significant health challenges and families who are dealing with losing children.
Organizations like the Bethesda Health Clinic help to bridge that gap.
The cost of health care has been a deterrent for a lot of people, especially the low-income people. We are income-based, so everybody has to apply, and we usually go by what their financial needs are. And sometimes, if they don't qualify, we still give them resources, community resources, to refer them to others that can actually help offset some of the costs.
With studies like this, Smith hopes to bring awareness to the need for healthcare resources and pediatricians for expected mothers.
We need care that we can train physicians and other healthcare providers from East Texas who will stay here and care for our community and be able to really fill those gaps that we know exist.
In Tyler, I'm Ashley French for CBS 19.